Hey friends, if you're dealing with knee stiffness resulting in lack of mobility and pain, I have a great video for you today. I'm going to walk you through the best exercises and treatment to fix your knee. Here we go. Welcome back friends, Dr. Josa here to help you move better and feel better. Thanks for tuning into the show today. And if you're new to the channel or haven't already, make sure you hit that subscribe button so you don't miss it on future videos. If you're currently dealing with knee stiffness, you know how frustrating it can be. Stiffness, resulting in lack of mobility and pain, can impact many of your daily activities. From getting out of bed, getting up out of a chair, going up and down stairs, squatting and bending down to the floor, and even walking. These daily activities can be difficult if your knee is stiff and you don't have normal motion in your knee. Knee stiffness can be a result of an acute injury or trauma to the knee, or if you recently had knee surgery. It can also be because of arthritis, also known as osteoarthritis. The best medicine for stiffness in your knee is controlled movement. Working into that stiffness, working into that end range is going to facilitate improvement in your range of motion and mobility in your knee and reduce your overall pain. On the other hand, stiffness will increase if there's lack of movement. If you decide to let your knee rest without movement, usually stiffness is going to increase, leading to worsening of symptoms and function. The first movement exercise we're going to perform in the seated position, we're going to perform heel slides. So in the seated position here, with your leg down, you're going to slide your heel back, working into that stiffness in your knee, hold 5 seconds, and you're going to slide back out. So slide that heel back, work into that stiffness in your knee, work into that end range to tolerance, hold 5 seconds, and you're going to slide back out. Work into that stiffness in your knee to tolerance will improve that motion and mobility in your knee to improve your overall function. Perform 10 to 15 reps, 2 to 3 times a day. The second movement exercise, we're going to perform heel slides on our back. So lying on your back, same idea. We're going to pull that heel up, slide that heel up, work into that stiffness, working into that end range in your knee. Slide that heel up, work into that stiffness to tolerance, hold 5 seconds, and then straighten that knee back out. Perform 10 to 15 reps, up to 2 to 3 times a day. Improve that stiffness and mobility in your knee. Hey guys, to further enhance that heel slide exercise, if you have a long strap, a rope, or even a belt at home, you can use this around your foot to further progress that stretch on your back to work into that stiffness even more. So lying on your back, you can loop around your rope or belt or strap around your foot. You can use that to pull your leg up to assist in that stretch to work into that stiffness in your knee. So lying on your back with that rope or belt around your foot, you can use that to pull your foot up to work into that stiffness even more. So use your hands to pull that strap up, work into that stiffness in your knee, hold 5 seconds, and then push back out. Using that strap to further enhance that stretch, work into that stiffness, hold 5 seconds, and then push back out. Same idea, you're going to perform 10 to 15 reps, up to 2 to 3 times a day to improve that motion and stiffness in your knee. All right guys, for the next movement exercise to improve that stiffness in your knee, we're going to be using a chair for this one, but you can also perform this on a step at home. So having your foot up on the chair for this one, guys, in that position, you're going to lean your body in, keeping your foot down, lean your body in, work into that stiffness in your knee, hold 5 seconds, and then you're going to relax. So leaning your trunk in, work into that stiffness in your knee to tolerance, hold 5 seconds, and then you're going to come off. So perform this 5-second hold, 10 to 15 reps, and you can perform this up to 2 to 3 times a day to improve that stiffness and range of motion in your knee. Another great exercise to work on that knee stiffness is to start to get some active movement of your knee. So in the standing position, we're going to get some active motion against gravity to improve that motion and stiffness in your knee. So in the standing position, up against the chair, you're going to lift your heel up towards the ceiling, bending your knee, lifting up to stiffness, to tolerance, come back down. So you're going to lift that heel up towards the ceiling, kick that heel up towards the ceiling, hold, come back down, working into that stiffness to tolerance. Perform 10 to 15 reps, up to 2 to 3 times a day. If you're having trouble in the standing position performing that exercise, I have a modified version you can also perform on your stomach. So laying on your stomach, you're going to pull that heel up, lift that heel up towards the ceiling, hold 5 seconds, and then slowly bring the heel back down. Perform 10 to 15 reps, work into that stiffness. Perform up to 2 to 3 times a day to improve that motion in your knee. All right, guys, I got a bonus exercise for you today. This is a self-mobilization or self-stretch of your kneecap or patella to improve that motion in your kneecap. That's going to help move your knee even more. So improving that motion and mobility in your kneecap or patella is going to help improve that stiffness in your knee. So with this self-stretch or self-mobilization of your kneecap or patella, you can have your knee straight. A couple different ways you can do this. You can use your fingers on all sides of the kneecap or patella to move it up and down, using your fingers along the 4 corners of the patella or kneecap. So you're going to push your kneecap down, work into that stiffness in the kneecap to tolerance, hold for 3 to 5 seconds, and then relax. You can also use the heel of your hand to push the kneecap down to mobilize or stretch that kneecap in the downward direction and the upward direction. Hold 3 to 5 seconds in either direction. Perform 10 reps in the downward direction and perform 10 reps in the upward direction. You can also use a C grip with your hand to mobilize the kneecap in the downward and upward direction. You can use the thumb and index finger around the kneecap, mobilizing that kneecap. Stretching that kneecap is going to help improve the mobility in the kneecap and improve your motion and stiffness in your knee. Thanks for watching today, guys. Perform these exercises to fix your knee stiffness and help with your mobility and pain. If you found today's video helpful, click that like button and the subscribe button so you don't miss out on future videos. I'm Dr. Josa, helping you to move better and feel better.